Hello and welcome to the Indian Community Podcast. I'm your host Amit Gupta, and today on the podcast we are joined by Jesse and Chetan, both founders of Impactful Giving. They are on a mission to make every rupee and every dollar that we donate creates real, measurable, and impactful change. So we're here to understand why the world needs this, why India is at the heart of all of this, and how they're building trust in the way we give. So, welcome to the show, Jesse and Chetan.
Great to be here.
Thanks for having us.
I'm sorry.
Thanks for having us on the show.
Great, thank you, Chetan. We're very delighted and very excited to understand all of this, especially. I think a lot of us do donate. There's donations that we do on and off, and then sometimes we're wondering, what's happening to these donations. Are they being really used in the right way? We don't know what's going to be done with it. So I was very intrigued when our common friend Brendan referred us to get connected, and he was like, okay, you should talk to Jesse, and he's doing something really cool and interesting. So I was like, okay, let's figure this out. So Jesse, let's start with you. What is impactful giving, and how is impactful different from the regular donations that we typically do?
Yeah, totally. So, impactful giving, you can think of us like an investment firm for nonprofits, where we want to help our donors maximize the impact of their dollar or rupee. We do tons and tons of research and partner with the best evaluators of nonprofits to curate a list of nonprofits in health and development, climate, and animal welfare that give you the biggest bang for your buck. And maybe I could start with a brief example of why we think this is so important. So you could take two nonprofits that try to address blindness. And let's say you have $50,000 to donate. One nonprofit, what they do is they train seeing-eye dogs for people. One seeing-eye dog costs about $50,000 to train. It's a very rigorous training program. You need people to do it. You need to find the dogs to do it. And they don't steal your money. They use it as well as they can, but they're able to train one seeing-eye dog for that money. On the other hand, you have cataract eye surgeries, which in the developing world cost about $500. And a cataract eye surgery will cure somebody of blindness. So if you have this $50,000, you could either get one seeing eye dog for a blind person or cure 100 people of blindness. And when you look at it that way, it seems like the choice of where to put your donation is pretty obvious. So put it towards the eye surgeries. But it's very hard for people to know where their money is going and how it's being spent. So we try to do the work up front to make sure that's possible. And what it also means is that your donation, when it goes to one of the best nonprofits, will be 10 or 100 times better than if you donate even to an average one.
Interesting. So, how do you understand all of this, right? So, how do you get to the root of this data? What is your strategy there?
Yeah, Chetan, I think you'd be a great person to answer this one.
Sure. So we partner with these research organizations, which are evaluators. So these evaluators actually collect data both from the end beneficiaries, wherever it's possible, and the nonprofits themselves, and match it with the evidence, the years and years of, let's say, clinical research or RCTs. So, and use that to make conclusions about what is the probability that, and what is the size of effect that this nonprofit has on people's lives. So there's some metrics that can be used. So for example, in health, there's something called QALY. So if a nonprofit is improving someone's life, if it's improving a QALY, which is a quality adjusted life year. So we can look at by how much each of the intervention is improving someone's quality of their life that year. Um, and yeah, typically typically some interventions in the medical science, medical field, the health field are much easier to measure, but the science is very young. So some interventions, let's say in animal welfare or climate, might be much harder to measure. But we're still getting there. We're still trying to generate as much evidence as possible.
And I'd also add this RCT, it's a randomized controlled trial, and we look at nonprofits that do these. What usually happens is an academic research institute or nonprofit will run one of these, and what they'll do is they'll take two groups, and they'll take the nonprofit intervention and give them to one group and not give them to the other group, and they'll measure the impact. One example is a nonprofit we support called Savita. They do text message notifications to new mothers to remind them to get their children vaccinated. And there was a big trial that was run where with half the people, you do this intervention where you send them new texts when their babies are born to get vaccinated. The other half, you do nothing. And they find a significant uptick in vaccinations for the babies who their moms did get the text message. That gives us confidence that this could work. And then we also we'll look at what that program it costs to implement.
Correct.
And so we can get down to the cost per vaccine that you get for that child. And when you know that, there's also data on what is how much does a vaccine help somebody? How much does it make sure that a baby doesn't die? How much does it make sure they don't get sick? And when you take all these factors together, you can get down to a really rigorous dollars per impact statement. And what we find is that the nonprofits that do this sort of rigorous data collection, they're usually operating really well because they care about data analysis and have that rigor. And then we can compare them against other interventions that do the same to find the best ones.
And that's very interesting, Jesse and Chetan. One new thing that I learned today was QALY. I was not aware of that. So that's a pretty cool way to look at things, especially, we always look at donations as, yes, yeah, you're helping someone, but this is really different where you're actually looking at the quality of life. I was also fascinated by that startup or that, nonprofit that you mentioned, Savita, you said, right, which is sending out text messages, something so simple as sending out a text reminder, but that's also changing lives and making an impact. So that's a beautiful way to do it, right? So now, why did you start all of this, right? Why does the world need this today? What's broken in how donations work as of now?
Sure. So I guess I can take that one. So in a usual market, right? In a usual market, you go to a business, you buy a product, you receive some value from the product. If you don't, you either complain or return, or you never go back to the business. But in the not-for-profit market, it's not the same. You donate to a non-profit based on some marketing, and the problem that donors face is that not knowing whether it actually added value to beneficiary, because you are not the one receiving the benefit, right? So that feedback loop, getting the information about whether additional value was created or not. So that's what's often broken in the not-for-profit market. So the whole game really becomes for nonprofits really becomes about who will do better marketing, who will be more popular, who will be on news more to get more donations, rather than about who's adding more value to people that they're serving. So, and that's where these evaluators or this research plugs in. This research is providing that information about how much of that value this nonprofit has really added per dollar, and should we keep supporting it or not? Are there better bets? Are there better options out there? So yeah, I think it's the information loop that's broken.
And to add to that, I'd also say that some of the nonprofits that are the best at marketing, that's their core competency. It's not actually delivering the impact. And some of the nonprofits that are best at delivering impact, their core competency is not marketing. So they're not going to be as good at it as these other nonprofits. So we see our sort of value add is being able to lift up those nonprofits that are doing really good work but for good reason, aren't as good at marketing or aren't focusing as much time on marketing what they're doing because they're so busy actually making a big change.
Correct. No, that's a very beautiful way to put it, Jesse. Because yeah, we often see the ones that are marketed very well and start judging all of them, right? So we kind of judge the entire industry based on the ones that we see that are being marketing, and sometimes we wonder if they have so much money to spend on marketing, why do they even need to raise money? And I think. Now when I'm talking to you, I can see there's another side to it. There's a lot of good work that's happening that doesn't probably get marketed ever, right? So folks like you help to bring them to the spotlight, which is great. In fact, we would love to have some of these nonprofits on our show to talk about them, and let's talk about this offline. But I think this is going to be an interesting segment for us to also start putting together. So that would be great. We could we could bring some of these stories forward.
Totally, we'd love that.
Great. So Jesse, there's one question. When I look at you and I'm like, oh, this guy's living in Boston. You're in Boston, right?
I'm in Boston, correct.
You're in Boston, great. And Chetan, you're in India. You're in Mumbai.
In Mumbai, yeah.
Nice. So why India? Why have you guys chosen India as your primary market, right? What makes giving over here or impactful giving over here so important than any other market?
Yeah, so there's both like a personal answer, but also a business answer. I'll start with the more businessy answer, which is India's at a really interesting time in its development cycle. It has a lot of growing wealth holders, but it still has a lot of people suffering from really basic problems and health needs. And it still has, last I checked, about 75 million people live in extreme poverty in India. Correct. So it both has people that are coming into money and might want to make an impact with their money and give back to their community. And it also has these big challenges that need funding and that are very effective challenges to fund. So I think this sort of market fit is a big reason for why India. I think it also gets neglected a little bit because it's not in total as poor as some other countries where the most effective interventions can be. But it does have pockets where people really need the help. And then I'll answer a little bit personal. Like, I also love India as a country. In college, I studied for a month at a university near Varanasi. I've been back many times since. So when I got the opportunity to launch this, I was really excited to be able to do it in India. The other thing I'd mention is Chetan is, excuse me, he's sort of an expert in the nonprofit space in India. He's launched really effective nonprofits, and I feel like he has great expertise to bring to the table that's India specific.
Excellent. And how did you both meet?
So we met at an incubation program. Actually, it's called Charity Entrepreneurship Incubation Program, run by this organization called Ambitious Impact. And the whole idea is to remove all barriers that nonprofit founders would have to start a really high impact nonprofit that can have that outsized impact in a measurable way that we were talking about. So during the program, we match with many different people, try working with different people. And I just loved working with Jesse, loved his spirit of wanting to really solve challenges in India. So, yeah.
And I'd also say this program, it's sort of like Y Combinator for nonprofits. They do a bunch of research every year to curate nonprofits that they think should be started. So they use a really research-backed focus. And it's a competitive program, like 1,000 people apply and they select maybe a dozen to do the program. So I don't know how we got in, but all the other people that, very high quality people, they're getting into.
Well, you were destined to make impact, right? So I guess that's what brought you both in, and it's nice that you guys were able to connect and sync up on this common agenda. So which is pretty cool. So what kind of charities do you guys work with? What's that typical thing that you look for in a nonprofit, and how do you go about shortlisting and then maybe um, then eventually start promoting them?
So, um, in order to find the charities which can have an outsized impact, we can't possibly go through each and every nonprofit on earth. We need to apply some sort of a filter. So the filter that we use, amongst other factors, is includes scale. So scale, how big a problem is, how many people can it affect, and by how much.
Hmm.
Then we look at how neglected a problem is. Some problems receive a lot more attention than others. For example, if you hear about a flood somewhere,
Hmm.
everyone would rush to give their money to help people, which is
Correct.
not a bad use of money. But if there's already enough money there, we don't need to divert more money towards that problem.
Hmm.
So we would look for problems which otherwise don't make headlines and remain underfunded while there's reasonable ways to make change. And that's where the third factor comes in. Is this problem solvable? Can we actually reasonably make some change on this problem? So we look for problems that have either some evidence or a reasonable way for entrepreneurs to go out there and test a couple of different solutions and try and improve lives of people. So this is the first filter that we sort of apply.
Hmm.
And the other tool that we have in Toolkit, which we've mentioned a couple of times here, and you're probably going to hear a lot more, is cost effectiveness. So not only we look at what the evidence is like, but and of how much they're able to help, but also for how much. Because I think that if one point listeners take home from this is, I would really want them to consider how much is this nonprofit delivering that value, because that's a question we often don't ask.
Hmm. And now, since you mentioned that, how much value does a nonprofit really bring in? So let's say somebody donates $100, right? How much of that really goes into changing lives versus everything else, right? So what's that typical range?
Sure. So that's a very interesting question, because my answer is not going to be straight. It's going to be that it really depends on the nonprofit, right?
Correct.
So some nonprofits deliver direct value. They would directly interact with the beneficiary. For
Mm-hmm.
example, a nonprofit that I founded was uh, helping improve newborn health and save lives of newborns. So we directly hired nurses which would interact with the newborns and their mothers. So
Mm-hmm.
there I can quantify very easily that, okay, per $100,000, this is how many newborns we were able to help. But then
Right.
there's some nonprofits which actually need a couple of years of research before they can actually deliver any value. Some of the research might actually not even be implemented by them. It might go to a state government, which would
Okay.
then unlock 1,000 crore budget to implement that program.
Mm-hmm.
So it really so the answer would be it really depends.
Mm-hmm.
Um, yeah,
So there could be a direct impact or an influenced impact, right? So,
yeah, or a
so that
systemic
and that's
impact.
going to define how much of that money is spent in what areas.
And just
100%.
to put some, ballpark numbers on it, some of the nonprofits we support, it's from 2.5 thousand to $6,000 is what we estimate it would be to save a life, to make sure somebody doesn't die. Uh, Another is about, maybe I'd say $50 to $200 to make sure that somebody gets 1 year of completely healthy living. For
Hmm.
instance, we make sure that they're not getting an illness that's really bad for multiple years. Uh, so that's sort of brass tacks of what these things could look like. But Chetan's also bringing up a great point, which is that by funding these nonprofits, you're helping them grow, and you're helping them get to the point where maybe another institution like the government
Hmm.
will see, oh, wow, this nonprofit's having a pretty big effect. Let's fund this in a really serious way and scale this across all of the country or all of the region where this problem exists.
Right. That's so cool. So I'm sure you guys touch a lot of lives every day. But out of all of those stories, can you share one which you feel extremely proud of? And people complain that you're always sharing this story. So maybe we want to hear that story once again, of any life that you guys were able to touch and you feel extremely proud about.
Sure, sure. Maybe I can take up that one. So before impactful giving, I actually co-founded another nonprofit, as I mentioned, which is working on newborn health in Rajasthan in India.
Mhm.
And the stories from around the time when we were launching the pilot for 6 7 months. So I went through this charity entrepreneurship incubation program, partnered with a bunch of healthcare facilities in Rajasthan, partnered with some local nonprofit which could recruit the nurses alongside us, and was aware of the cultural dynamics of the area. And after all of that, we actually went into the hospital first day, and we start getting mothers and babies that we are treating. And before all of that, in my head, I was that person. Okay, I have a vision. I want to be able to save as many newborns as possible, and I was just really excited about the big vision, the numbers, what it could look like on the spreadsheet. So trying to drive down costs and all that. But the moment that I saw nurses taking care of the babies, taking care of helping mothers take care of their babies as well, and like weighing them, making sure they get all the care that they needed. That's when I realized that, hey, actually, I'm thinking all these numbers, but then this is so real. This is so real. Today, finally, I'm actually able to say that, hey, I there's a 33-34% chance that I saved that newborn's life. So I think that was both a very happy moment, but also a moment of a lot of weight, because every action that I take, every decision that I take means I could be saving more or less lives. So yeah, that's the one I would share.
Beautiful. Jesse, do you have any stories for us?
For me, I think I've always just been sensitive to suffering in the world, whether it's seeing somebody on the street in the US and India, whatever it is. And it just hurts me to see so much disparity of resources that people have.
Hmm.
So mine is kind of more abstract. It's that I see this in my day-to-day life wherever I am, and I want to change it. And it's really motivating to me to think that uh, using these tools that we have at Impactful Giving, that I can do that as much as possible, save the most number of people as possible. So there's not one specific story, but that like abstract feeling of I don't want there to be all the suffering in the world is what really drives me.
That's so cool. No, I think I understand where you guys are coming from, and you're looking at it from a 40,000 bird's eye view and saying, okay, how can we change the whole ecosystem here, right? How can we improve lives at scale? So this is a pretty fascinating project that you guys got into. So tell me, how do donors work with you? So I understand that you're doing all of this research, you're shortlisting these nonprofits, but then how does a donor engage?
Yeah, so there are multiple ways.
Hmm.
One, we have a website, impactfulgiving.in,
Hmm.
which has all of the resources that we look at, all of our recommended nonprofits.
Hmm.
It's some tools, interactive tools that you can use. So it's a great starting point for people curious just to learn more. And then we also do philanthropic advising. So if any of the listeners would want to book a call to talk to us, ask any questions they have. We can both answer any of your questions, and we can also take you through some exercises to try and
Hmm.
understand what your values and priorities are. And that really
Right.
helps people know which nonprofits they'd be really interested in supporting. Uh, so those are the couple different angles that we try to give people to have at their disposal to learn more.
That's beautiful. And what's next for impactful giving? So what's like, what's the bigger vision for tomorrow?
Sure. Um, so I think we want more and more people out there to be able to think about their donations as they think about their investments. When you think about your personal investments, you're trying to really maximize ROI, and you're using your head as much possible because it's about the money, right? When people think about donations, they're thinking from the heart, which is amazing. But at the end of the day, you're still using the same money that you were using for investments. So why not also apply the same tools that you apply for investments out here and maximize the value, not just for you to feel good, but also to be able to save more lives. So and most people would actually agree that saving more lives is better than less. So yeah, I guess the larger vision just really is to get as many people possible to think about the donations like they would their investments.
And we want to propagate this, throughout this philosophy throughout India for donors, for stakeholders, for nonprofits as well, just to help build a stronger, more robust nonprofit ecosystem that's
Mhm.
using like data and analysis to inform choices on how they help people.
That's cool. So Jesse and Chetan, there is this Hindi quote, and Chetan, you might be able to relate with it, but Jesse, I'll explain it in a bit, unless you understand Hindi. So forgive my ignorance.
I don't. So
So I always grew up, I was raised in India, and there was this quote that sticks to me, and I think I'm going to change that now after this conversation. It was like "Neki kar darya mein dal." Right, Chetan? Have you heard of that?
Yeah, I've heard of it 100%.
Yes, you have it, right? So Jesse, that was like neki kar is like do a good deed, and then darya mein dal means forget it, right? Do a good deed and forget it. You're not don't stick to it for long. So that was a proverb. Now, when I hear what you guys are doing, I think you're actually the ones who's orchestrating this darya or this ocean of good deeds, right? So I'm really excited to see what you guys are actually up to. I'm glad that Brendan, I call him fondly as the greatest cheerleader of India. And and I'm proud to see that his company is also supporting impactful giving. So that's really a testament to his vision for India in that sense, right? And I'm proud of the work that you guys are doing, and I'm really excited. In fact, I'm going to encourage everybody to look at the comments below, look at the description of this video. We're going to put your links to impactful giving, and maybe links to your LinkedIn as well, so people can reach out to you and speak to you about the great work that you do. And I'm glad that we were able to book time and discuss this. Any last messages that you want to give to our audience before you guys sign off?
Well, likewise, thanks for having us. And I love the quote that you gave. I feel like it speaks to uh, really real humility about giving, which I love. The last thing I'd say is giving. It's a very personal choice. It's often, and it should be, very heart driven and heart focused. And our goal is to preserve that, but also add some of the head focus and really think about these analytical things. So when you give with the head and the heart, we feel like that's the best way to truly make impact in the world and have your values be reflected in the nonprofits that you donate to.
Excellent. Yeah, and I think that's been the Indian culture also, right? So we've always been a country that gives, but with the heart. It is interesting to note that you're able to bring in the head, so that you're giving in the right places, you're making real impact, and I think that's something that's really important for the world that we live in, especially so that you build trust in the act of philanthropy, right? I think organizations like yours are really critical for building that trust.
Awesome. Yeah, and thank you so much for your kind words, having us on. Uh, yeah, it's just really great to be connecting with other people that care about this sort of thing.
Excellent. Thank you, Jesse. Thank you, Chetan. And for all of our listeners, please do visit impactfulgiving.in and make sure that you give and help these two gentlemen make impact, right? So thank you.
Thanks
Thanks,
so much.
Naren. Thanks,
Thank you.
everyone.